Here at NYU Langone Health, we have been working with hypertrophic cardiomyopathy patients for over 30 years. We have one of the largest and most long-lasting experiences with management of this disorder than anyone else, not only in the country, but actually in the world.
I believe the care at NYU for HCM patients is unique for several reasons. One is the facility is world-class. The technological advancements that we have here are second to none. But I think for the HCM patients in particular, you have this vast history of experience both on the medical side and the surgical side that really kind of covers the entire base.
Here at NYU, we have all of the facets of HCM care covered.
There is no one-size-fits-all. Everybody's hypertrophic cardiomyopathy is different. It is very important to get to know the patient very well and understand their goals and values. We usually will strive to start with medical treatment first.
When I started treating patients with this condition, there were two drugs, and it occurred to me that for patients with obstruction, a third drug, disopyramide, would be very helpful because it's been shown to be a strong negative inotrope. It decreases the contractile force of the heart, and I started investigating that particular medication. Now it's a class 1 indication for administration to patients with obstructive HCM who fail first-line therapy with beta blockade.
If medical treatment doesn't achieve the goals of the patient, then an intervention may be necessary.
Because of the nature of obstruction and how obstruction is different for every individual's surgical procedure has to be tailored for that individual alone. Based on all those different variations, this surgery is best performed in high-volume centers that specialize in this exact disorder. So there may be lots of centers that treat hypertrophic cardiomyopathy medically. There are relatively few centers nationally that have high-volume expertise in surgical management. Septomyectomy, simply put, is shaving or removing the overgrowth of heart muscle that is inside the main pumping chamber, the left ventricle. That overgrowth often involves the mitral valve. These two structures conspire to cause a relative obstruction to outflow from this main pumping chamber. Dr. Sheridan and I have devoted our careers to the management and improvement of management for hypertrophic cardiomyopathy, and we've been involved with a myriad of advancements. I've been involved with a number of new and novel experimental and now proven surgical techniques. Management of hypertrophic cardiomyopathy can often be a little complex and confusing, and we here at NYU Langone Health have a great team approach, specializing in the individual's management issues, whether it be complicated medical management or complicated surgical management. So it's the team approach that has led us to be as successful as we are in doing the best that we can for the individual.